Young people who persistently abuse substances often experience an array of problems, including academic difficulties, health-related problems, poor peer relationships, and juvenile justice system. In this presentation, I'll be discussing supporting health communication campaign on drug abuse by teenagers. I am Onyekwe Chidemma. Teenagers often experiment with a variety of activities and substances. Unfortunately, this experimentation can lead to substance abuse and addiction. Statistics show that drug abuse is a growing problem among teens. A recent survey showed that substances commonly abused include marijuana 31.5%, Vicodin 9.7%, amphetamines 8.1%, cough syrup 6.9%, and sedative and tranquilizers 6.6% each. In this poster by the CDC is trying to create awareness that 1 in every 7 high school students were reported to be misusing opioids at least once in their lifetime. And they also stated that schools can develop substance use prevention programs and implement programs with individuals, schools, and families. What CDC is trying to say in essence is that schools are appropriate setting for drug prevention program because they focus on children before their belief and expectation about substance abuse are established. Moreover, schools offer the most systematic way of reaching young people. Also, their emphasis is also on family intervention. They believe that there's an overwhelming evidence that parents' lessons and involvement reduce the risk of substance abuse habits, particularly when started at an early stage. So invariably, CDC is trying to say that both schools and family, together with the individual, have a role to play in drug prevention programs. The purpose of this CDC campaign is to alert the public on the high rate of drug abuse among the teens, to get the school to develop substance use prevention program, and then implement program with individual schools and families. The aim is to create awareness for people to appreciate its existence, also to develop programs for prevention so it does not occur, and then implement the program when it occurs with individuals, schools, and families. On this slide is a flyer that I developed to support the CDC campaign. This flyer says, "Stop substance abuse. Together we can." You can see all hands on deck, held together, showing that there is need for collaboration, there's need for combined effort between the family, the school, and the individual for this substance abuse to be stopped. On the left side of the flyer, it says symptoms of drug abuse. That's the symptoms that parents or anybody can watch out for to know that such a child is, or a teen is abusing drugs, like depression, problems at school, mood swings, loss of interest in favorite activities, violent behaviors, withdrawal, poor hygiene. Drug abuse at any stage can cause serious health effects, but teens who abuse drugs are at particular risk for negative consequences. Teens who abuse drugs are more likely to struggle with addiction later in life and have permanent and irreversible brain damage. Some common negative effects they could have include emotional problems, behavioral problems, addiction and dependence, risky sex behavior, learning problems, diseases, car accidents. You can see them listed on the right side of the flyer. Below, on the lower part of the flyer by the left, it says our services are free, no insurance needed. This will make whoever that receives it know that he doesn't have to have an insurance or he doesn't have to have money to be able to get these services. And the address of who to contact, both the phone number and the working office, is written on the lower right part of the lower right side of the flyer. The goal of this campaign is to prevent or at least diminish teenagers' use of a variety of illicit substances and promote the health and well-being of these teenagers who are the leaders of tomorrow. One may begin to ask, how can we achieve this? when there is a reduction in crime related to a contracting cocaine marketing, when less money is spent on health care for smokers, when there is higher productivity associated with decreased alcohol use, we will provide a clearer understanding of the merits of drug prevention program. And then this finally will align with the goal of Healthy People 2020 that says to attain high quality, longer life free of preventable disease, disability, injury, and premature death. Thank you for listening.